Awesome. Yes, good afternoon, everyone. It's still morning where I'm at, and I'm happy to be here. So my name is Ahmad Elhaija. I'm a medical student at the UCLA David Geffen School of Medicine and founder and CEO of the International Collegiate Health Initiative, ICHI. Today, I'm going to be talking about investigating the underlying factors of homelessness in the Skid Row community. Next slide. All right, so quick background on our organization. We're a 501c3 nonprofit based in UCLA, founded in 2017. Our team is composed of undergraduate students, graduate students, a board of directors, and professional advisors. And our mission is to promote health equity and improve the overall health of the Los Angeles and international community. We provide services through healthcare safety nets and multiple sanctuary clinics. Our ICHI clinics are established in the cities of Maywood and Bell, which are in Southeast Los Angeles. Next slide, please. A quick project overview. So we conducted a community needs assessment in Skid Row, which is in downtown Los Angeles, and a comprehensive review of the literature regarding community-based solutions to meet homeless people's needs. The goal of this study is to evaluate the needs of homeless individuals in the Skid Row community and better tailor services for the homeless population residing in the area. Next slide, please. For a quick community context, downtown Skid Row is a 55 square block area in Los Angeles with a large population of individuals experiencing homelessness. As of 2020, Skid Row had a population of 4,662 homeless individuals, with approximately half being unsheltered. In Los Angeles, 28% of the homeless population have a substance use disorder, and 25% experience serious mental illness. Common health needs among homeless individuals include access to medical or surgical care, prescription medications, and dental care. Next slide, please. So, as I said, we conducted a community needs assessment and a comprehensive review of the literature. We then conducted a descriptive analysis of the data from our needs assessment surveys, and we provided percentages and mean answers to the survey question categories. Next slide, please. So for our surveys, we conducted a convenience sample of adults residing in Skid Row on 3 separate days between 2018 and 2019. We had over 160 respondents. We used a cross-sectional survey approach to conduct the community needs assessment, and the survey contained questions regarding age, demographics, drug use, medical service use, benefits received, needs, and other things. We then conducted the descriptive analysis, and IRB approval was not required for this study, as all surveys were conducted anonymously. Next slide, please. For our first set of findings from our data, we uncovered unmet health, social, and employment needs among unhoused individuals in Skid Row. Over 80% of individuals who took the survey self-identified as homeless, and over 75% were seeking housing. Over 75% of the homeless individuals surveyed reported having health insurance. The most common health insurance provider was Medi-Cal. There was also a high unemployment rate, with over 45% of respondents currently seeking employment, and over 80% would consider themselves struggling financially. Next slide, please. Over 75% of individuals surveyed are interested in accessing health screenings, and over 40% of individuals self-reported they experienced struggles with their mental health. Over 50% of individuals stated they currently smoke at the time of the survey, and about 40% of total survey respondents had undergone prior treatment to quit smoking. The most common response in regards to the utilization of potential financial assistance was paying for housing. Next slide, please. So from our literature review, these are a set of findings. Unhoused individuals face disproportionate risks for developing health complications the longer they remain unhoused. Knowledge, financial constraints, and provider attitudes were often cited as barriers to healthcare services, which is consistent with findings from our survey. And the social needs of unhoused individuals are often intertwined with their medical and mental health needs. 63% of the participants who screened positive for PTSD or depression did not utilize mental health services. And both the literature review and survey findings revealed unmet mental health needs. Next slide, please. So here are some limitations from our study. All surveys were taken by the individuals themselves, so the answers are self-reported. The answers could have been skewed by potential social biases, and individuals could have different understandings or definitions for terms within the survey. Responses could also be biased due to stigma related to mental health and homelessness. Next slide, please. For our discussion and recommendations, we found that service priorities include mental health care, tobacco cessation, and employment services. There's a need to better understand chronic disease management and prevention and maintaining a regular source of preventative health care for this population. So the vast majority of the individuals, in spite of them being homeless, did have access to health insurance, but they chose not to use it. This was due to various reasons, such as, lack of education on why it's important to use it, how to use it, and not feeling motivated to use it. So addressing those issues could result in better outcomes in terms of them utilizing their healthcare providers. Next, utilizing a next would be utilizing a psychosocial approach to address specific needs may improve the overall health of unhoused individuals in Skid Row, and promotion of employment opportunities through partnerships with Skid Row-based social service organizations. So a lot of the individuals desire to get back into the workforce, make money again. So just doing so right away may be a stretch for their situation, but slowly reintegrating them into the workforce by offering psychiatric and drug cessation interventions to where they could then graduate and receive internship opportunities from Skid Row-based social service orgs. They could then get back into the workforce or further their education. And last, increasing psychiatric accessibility is a potential approach to meeting the community's mental health needs. So there are not enough psychiatrists available within the area to meet the mental health needs of the community. Increasing that accessibility would go a long way in addressing their mental health issues. And yeah, that was my presentation. Thank you, everyone.
Thank you. This was really an interesting presentation. First, I'll ask, does anyone have any questions? Okay, I would like to ask a question if that's all right.
Absolutely.
I'm coming from New Orleans, so we have a substantial homeless population here as well. However, our populations are very migratory. It's very hard to keep track of where they are, and it's been a real barrier for getting them care in the city. I'm just curious about the Skid Row community specifically. Is this something where people kind of stay on Skid Row for a long period of time, and therefore you're able to follow up with them and kind of maintain some continuity of care? Or is it similar to the homeless communities that I've worked with in New Orleans, where it's sometimes they move on to a new area, even in the same city, and you just lose track of them?
Yeah, that's very interesting that you asked that. Actually, I feel it's different here to where they're pretty much most of them are pretty much trapped in that community, and a lot of them identify with it, are proud of being from there. Also, the way it's set up in downtown Los Angeles, it's just far more comfortable for the individuals who are stuck there to stay there, because there are a lot of there's the Midnight Mission, there's the Union Rescue Mission, the Weingart facilities. So they do have access to these facilities where they can get shelter, food, non-psychiatric counseling, etc. And there's like a solid community in terms of people building friendships with each other. That's not to say that the area is great. It's absolutely not, but it is far more comfortable than other areas in Los Angeles for them.
Thank you. I've obviously never been to Los Angeles, so I was curious.
Oh, awesome.
Yeah. Okay. And